Hello, this is Dr. Do again. This video is still on alphabetic list problems on letter S. Today I'm going to talk about the sepsis and the septicemia, and probably just mention bacteremia. What are the difference between these? These are just the concept. In general, these are the infections. Could be transient, could be serious, and the causes might be different. But let me just bring up the emergency situation. Any emergency situation associated with this sepsis or septicemia. Yes, usually the septicemia, which means the bacteria not only in the blood but cause a serious organ or system damage. So that's the case. If the sepsis causes this the blood pressure dropped, the fever is high, cannot brought down, and chills, and also associated with other damage like altered mental status or severe abdominal pain or any other problems. You need to really, particularly if the temperature is about 102. So that's really emergency situation, especially for the young children or for those older people with pre-existing conditions or newly infections. So this is the emergency situation because the sepsis could cause shock, septic shock, which is quite life-threatening and severe. So that's the case. You need to see the emergency as soon as possible. Can you manage at home? Probably no, because it's like the common sense. If there's a bacteria in the blood called bacteremia, which is sometimes could happen on the procedure might cause this, but it doesn't mean the bacteremia will cause severe symptoms if the normal people with normal immune function and take some medications. But the septicemia, which means those bacteria in the blood cause the serious infection. So regardless, if I talk about the septicemia, you cannot manage at home. It has to be managed by the physician. First of all, has to be identify the strains of bacteria, either gram-negative, gram-positive, or also has to identify whether they're the normal flora of our body or just get from somewhere else. Has to be treated with antibiotics that target the right bacteria. So anyway, there's no way you can manage at home. So let me just bring up the fundamental concept, the bacteremia, which means there's some probably bacteria in the blood. If it's culture positive, that means definitely confirmed. Usually it could be post-procedure, cause the transient bacteria in the blood circulating without any serious medical conditions and without any culture, without any known you have it, but it could be transient. Or on top of this bacteremia, you have the septicemia, which means the bacteria in the blood cause this severe systemic infection, sepsis. If that's the case, like I mentioned, sometimes the sepsis could be severe, because the septicemia actually is the word really emphasizes the severity of the disease. Sepsis could be could or could not have the septicemia. So this is the kind of just the terminology to explain to you. If you see this kind of diagnosis along with your discharge paper or you see it somewhere, then you know what it means. So this is basically the cause of sepsis. You all know respiratory system, digestive system, or urinary tract. So these are all and also even the skin can contract the bacteria in the body. For the normal health people without pre-existing conditions, with antibiotics treatment, you might be just recovered. The bacteremia may be just transient. After antibiotics, everything is better, it's gone. But for those young children, particularly infant, newborn, or young children, or the elderly, or those who had pre-existing systemic diseases, morbidities, like the chronic kidney disease, chronic lung disease, or cardiovascular disease, or obesity. These are, for those people, or diabetes, the immune function is not as normal people, so they susceptible to the infection. So if this is the case, then the simple break of skin for normal people just healed with the scar, without scar. But for those, particularly for those older people, if they have pre-existing conditions, diabetes or any other problem, the scar may not, the wound cannot be healed and cause this bacteremia, and severely, or in the worst scenario is called septicemia, which can really sometimes, particularly gram-negative rods, can be really serious, cause this toxic shock or infection, septic shock, with low blood pressure, and the heart is, all the organs might be going to the failure and to the eventually irreversible process. So the taking home message is for those, regardless, first of all, for the healthy young people, for this group of people, if you feel somewhere you have fever, could be from respiratory system, the skin, the digestive system, or the urinary tract. If the fever cannot be brought down with medications for a couple of days, see your physician, particularly the high fever with chills, and particularly without the nasal congestion, without upper respiratory tract infection symptoms. So if that's the case, it means something else could be serious, more serious. And then you need to see your physician to either use optimal anti-bacterial medication, antibiotics, or could be culture target, or could be the empirical treatment. Or for those who had pre-existing conditions, or older people, really you need to follow up with your physicians regularly, and to know how to prevent, how to identify the infection, especially for long-term uncontrolled blood pressure, blood sugar, or the obesity. So these are all the problems, hyperlipidemia also, or chronic disease of liver or kidney. So these are all group of chronic serious conditions. Can really a simple break of skin, like the simple wound, can really sometimes pay severe consequences. So see the physician if the wound, or if other symptoms or infection or the fever the wound cannot be healed, or the fever cannot be brought down. Don't hesitate. See your physician. Get it identified. Get it treated as soon as possible. So this, and also for the young children, particularly for those young children, lost the strength and high fever cannot brought down without a serious coughing, or without the symptoms of coughing, nasal congestion, and just the fever. That's very kind of a sign of alert. See your physician as soon as possible. So this is about, I think it's quite probably common sense, you already know it, but I think I just figured to just put here to hope it helps and remind you. So thank you for watching. I'm going to stop here, and I'll see you next time.